Now it's time to go ahead with the third show and tell, the last one on today's event. So we will have four companies. Remember, 4 minutes of glory for your demonstrations in terms of digital health. And well, let me introduce you the first show and tell, and will be from Medify. Johannes Moy is a manager operational excellence at Medify, a company that produces software to clarify healthcare for both patients and healthcare professionals. Johannes will present the MEX and the dashboard solutions created to educate the patients in a visual way and integrate them in the hospital's work processes. So, here I have you. Johannes, thanks for your time. The stage is yours, and remember, here is your countdown, right?
Perfect.
Thank you.
Thank you very much.
Thank you. Yep, it is.
Okay, perfect. Good afternoon, everybody. I want to start off with a TikTok video of an orthopedic surgeon that illustrates a typical situation when he explains the upcoming procedure of the patient. The video I will show is a funny comic video, but in fact illustrates a problem that has been existing in healthcare for many years. Namely, that the patient has no idea what is going to happen during the surgery, what can lead, therefore, to anxiety. Please put on the movie. The movie, yeah, there's the movie. Okay. Again?
Hi.
Yes, this is it. The good news is that we have a solution for this problem. At Medify, we are specialists in visual explanation of medical-related information. Our main focus areas are patient education, shared decision-making, research, and e-learning. So how does our service work once implemented in a hospital? Movie, keep. Okay. So how does our service work once implemented in a hospital? As a hospital staff member, I log into a dashboard from where I can monitor all the invitation I've sent out to the patients. And as well, I can create a new link from here. I fill in the patient's ID and email. I select the procedure, and the patient receives an email. In this case, is a bronchoscopy. I click on send, and what happens then is that the patient receives an email with an explanation of the digital intake, and they click on the link to open it. They will now see the entire stepwise explanation of their procedure. So really, from the preparation at home until they leave the hospital again. I will show an example of a video here. As you will certainly hear, the video contains a voiceover. Here the device that is being used during the procedure is being explained.
The tube with which we will perform the examination is called an endoscope. It is first thoroughly cleaned and kept in a special clean cupboard. The clean endoscope is fed into a box.
In the core of each application, we have a 3D visualization that explains the procedure itself. As you can see here, the pulmonologist is inspecting the bronchi. And then, in the end of the application, we have a questionnaire that collects medical information and informed consent of the patient. In this case, the patient actually can sign their approval for the upcoming procedure, because they're better aware of what the procedure is, what the risk and complications are, what happens after their procedure. The questionnaires can be also used for prompts and prams after the procedure, or ask questions to measure the learning curve in case of e-learning or research. When a patient has clicked on the send button at the end of the questionnaire, it will become visible on the dashboard again. And in here, I can already see on which aspects of the patient's health I have to pay attention, because they're indicated in red and orange. Normal health aspects are displayed in green. Yes. So, this is an individual response, but I can also see reports of an entire patient population. I've showed our service in its standalone format in our dashboard. The whole invitation and questionnaire response part can also be fully integrated in the hospital systems using Health Level 7 integrations. An example of the research and e-learning functionality of our platform is this clinical study that found that patient education via our Max results has the same quality of bowel preparation compared to traditional nurse education. Finally, we also make e-learnings for the industry, for example, to teach hospital staff about a new device that they're going to use. At Medify, a multi-skilled and multinational team is looking very much forward to collaborate with you. If you have any questions or are interested, please come visit us at booth number 19. Thank you for your attention.
Medify, let's move to citizen communications. Let me introduce you, Mr. Alan McKay. He's the Managing Director of Citizen Communication. And Alan is here to show what the UK's NHS is achieving in positively influencing patient behavior with data-driven personalized video communication. So, good afternoon. The floor is yours, Alan.
Thank you very much indeed for your time. I'm going to talk about data-driven personalized video. It's occurred to me actually in this last just hearing this last presentation that actually what we've got here is something that enables patients to navigate the new world of healthcare. That's one of the things that everybody is going to need to address. The world in which we operate in is changing dramatically. And what we have here with our personalized video product is the ability to use the video medium to communicate en masse at scale, but personally, using data and information that is specific and relevant to the individual in a video form. So whether that information is test results, whether that's about signposting people to services that are available in their community, or whether that's just about connecting with people on a human basis by giving them the reassurance that people just like them are doing okay, they're doing well out of the services that are being provided, this is where personalized video has a role to play, helping people to become much more active participants in their own health and well-being. We are already working on projects which are covering areas such as disease prevention, chronic disease management, mental health, well-being and support, and promoting and signposting people to digital services. This is not new technology, this is becoming already a part of the communications armory of major brands and organizations, both here in the UK, here in Spain rather, and in the United Kingdom, all of whom are using this technology to do most of the things that health systems need to do in a post-COVID world. We are already working within the UK's National Health Service, and if any of you know anything about the NHS, you'll know that that is a real achievement in its own right. I had hair before I started working with the NHS. And as you can see, what we're seeing from that is that this is proving to be a highly effective way of positively influencing patient behavior. We achieve exceptionally high rates of engagement, which leads to measurable behavior change. And, as I'll show you in a moment, we're doing that across all sections of the population. In this last year alone, about 100,000 patients have received one of our videos. We're supporting diabetes prevention, we're supporting diabetes, type 2 diabetes care and self-management, and we've been supporting people living with a range of long-term conditions during COVID. NHS England themselves have analysed our data and have confirmed that we are achieving significant behaviour change. Just one of the figures on this chart here indicates patients are 4 times more likely to attend care interventions having watched a personalised video as compared to the control group who didn't receive videos. And as I've already said, we're doing this across all sections of the population. It is interesting to note in the middle there, in terms of age, people aged 75 plus at the far right-hand end of this chart are interacting with this content and responding to the content in precisely the same degree as people aged 18 to 29. So what we've got is something that is highly relevant. It maintains that human connection between patient and care provider. It nudges people to act, for those of you that are into the behavioral science of all of this. It gives people time to process information so that they can become much more active participants in their health and well-being. And we've got loads more to share with you. We're downstairs. Please come along and say hello. Thank you very much.
Thank you very much, Alan. Please, here. Well, third round of show and tell, third company right now. So let's carry on with Nexi for Children. I want to introduce you Claudia Gustems, who is head of partnerships at Nexi for Children. What's Nexi for Children? It's a startup focused on helping children prepare for difficult procedures and reducing anxiety before visiting the hospital through virtual reality experiences. So, Claudia, the stage is yours. Here's your countdown. Whenever you want.
Thank you. Hi, good afternoon. I would like to start by introducing to you Julian. Julian is a 10-year-old kid. He was our very first patient, and he was about to go under surgery, but he was really nervous, he was really anxious, and he would have stopped crying only because his older brother had a really bad experience, so that was his only reference. The problem here would be that 500,000 kids go through surgery every year in Spain, which means that 60% of these kids would go through preoperative anxiety, which translates to more anxiolytics intake, longer recovery time, and regressions on the behavioral side. That also will cause traumatic experiences and a change on the perception of pain. So our approach to that would be to create a tool that's an exposure tool that has an easy implementation, which means that the kid would be autonomous, that is clinically validated and treats family as a unit. Not only the patient, but also his surroundings, the doctors and the patient and the family. Okay, so there. I would start by introducing myself. My name is Claudia. I'm head of partnerships at Nexi for Children, and today I'm going to explain to you how that works.
Esta es la sala donde haremos las fotos especiales que nos dejan ver dentro de ti. Para hacer eso, hay que quedarse muy quietos. Y para ayudarnos a que no nos movamos, María hinchará un colchón que cogerá nuestra forma.
This is a part of the radiotherapy experience that the kids see through these goggles, these VR goggles that they are given before surgery that they can play with and use to get to know better what they're going to go through. And these are some of the use cases. We are mainly based on surgery for all kids that are going to go under surgery, and then radiotherapy, as you just saw. We're partnering up with some foundations to develop these kind of experiences. And we also develop hemophilia. We're about to launch it. And we're also trying to investigate a little bit the environment on where adults could use VR as well in cardiac surgery in this case. This is the Nexi kit. That's what they're given. That's what they will play with. That's what they be using to get to know what they're going to go through. Mainly the goggles that I just showed you. Then the mini Nexi, as you can see here. And they will also have access to a virtual platform where they can get to have more information about the surgery and the procedures that they're going to leave. Again, what I said, the information that they will find also links to more content and extended content and frequently asked questions that can be useful for the family. As I mentioned before, that's something that we designed for family, patients, and the doctors. Also, that knowledge on families helps the doctors get to know better and open channel communications with the families. This is the panel that the hospital has. They can keep track of how many times and how many times the kid has used this Nexi kit, how many times they've seen it, how useful it was, and how much time they've spent on it. So this is the Nexi family. Today with me, I have Tomás, the CEO and founder of Nexi for Children. Of course, Nexi, he's the one doing the heavy lifting. We're just helping him. And we're really glad to be here and explain to you our project. We are looking forward to meet you and help you with all the questions that you have. We encourage you to come visit us in booth number 11. And for those who are online, you can just contact us on LinkedIn, and we'll be happy to answer your questions. Thank you.
Yes. Thank you, Claudia. Nice presentation. And let's go ahead with the last show and tell. And it will be from SMTP and Josep Rodiera. Hello, good afternoon. He's the CEO of SMTP, a company ready to offer a seamless, all-based digital solution to hospitals and professionals that will ensure a more robust, safe, and patients-oriented solution for perioperative processes. So, good afternoon, Josep. Thanks for your time, and the floor is yours.
Thank you very much. I am Josep Rodiera, CEO of Smartmed Tech. I am also an anesthesiologist, and I have a Master of Bioengineering. Smartmed Tech is a company who develops digital solutions to help professionals, especially nurses and doctors, to follow the guidelines in the context of the surgical process. I'm sorry. Surgical process represents between the 60 to 80% of the total cost of the hospitals in Europe and the United States. And in the other hand, the deviations of the clinical guidelines is the most important factor in the prolonged stays of the hospitals and surgical complications. This has a very high impact in the health of the patients and in the cost of the healthcare. Digitalization powered by artificial intelligence can customize patient perioperative journey while improving its wellness, easy practitioners' works, and create a safer environment. Our solution is based on artificial intelligence data processing, which with advanced analytics processing, who allow professionals, nurses, and doctors to lead the perioperative process following the guidelines and for the patients to live a patient experience tailored patient journey. Our platform is interoperable, is modular, could interconnect the different parts of the surgical process and the different professionals involved in them. The platform ranges from the preoperative assessment to the postoperative care. In the perioperative assessment, where we are detecting and evaluating the risk and the assessment of the patients, we detect and evaluate the complexity of the surgery, and especially we prepare the patients from facing the surgical procedure. During the intraoperative process, we have to customize the plans to ensure that the efficiency of the process helping the professionals to do the things better. Also, in the postoperative care, we should to take care about the pain of the patients and monitoring the evolution of the patients. In Europe, there are more than 30 million years of surgical procedures. The following of the guidelines has an impact, direct impact in the results of the healthcare, and has a clear benefits on patients and on professionals, surgeons, anesthesiologists, nurses, the rest of the staff. We have a team very well balanced, with there are doctors, nurses, engineers, there are science, data science, and physics, who are working together to get applications to help professionals to do the things better. Thank you very much. We are working for professionals and patients, and we can attend you in our booth in downstairs. Thank you.
Thank you, Josep. Well, That was the last one. We had an amazing show and tell session during all the day, don't you think?